Talk about diagnosis according to pathogenic Qi. This time we discuss heat and fire. Before discussing heat and fire imbalances, it is important to differentiate between pathological heat and physiological heat. All of the body's Qi functions are dependent on physiological heat. There would not be any kind of transformation or transportation in the body without this heat. Physiological heat is an aspect of the body's yang qi. Pathological heat does not have any beneficial physiological qualities. On the contrary, pathological heat only has a negative effect on the body. Pathological heat, which includes fire, will overactivate the functioning of various organs. It will agitate shen and blood, as well as desiccating and injuring yin substances in the body. Furthermore, fire can generate wind and create phlegm. The difference between heat and fire is mainly a question of intensity. Fire is a stronger and more aggressive form of heat. Fire is described as being more solid than heat. It is more drying, damages body tissues, and can agitate blood to such an extent that the walls of the vessels rupture, resulting in bleeding. Fire will also agitate shen to a greater extent than heat does. There are various forms of pathological heat and fire in the body. We will briefly outline the various forms and how they arise before going into detail in describing their specific signs and symptoms. Heat can arise from any exogenous invasion, such as when the body is invaded by wind heat, damp heat, and summer heat. Exogenous pathogenic qi, such as cold and dampness, can transform and become internal heat or fire when they penetrate deeper into the body. This is because of the clash between Zheng qi and pathogenic qi. The body itself is warm in nature. This means that pathogenic qi will eventually be affected by and take on the character of its host and its surroundings. Heat and fire can also arise from internal imbalances. Consuming food or drink that is hot in its dynamics, such as alcohol and hot spices, will generate excess heat or fire. Smoking can also result in internal heat. Heat and fire can also arise from emotional imbalances, particularly when qi stagnates over a period of time. Any stagnation in the body, whether it is qi, dampness, phlegm, or blood stagnation, will in the end begin to generate heat. The difference will be in how intense and systemic heat is. Fire and heat are desiccating and will injure fluids and yin in general. Therefore, there will be symptoms and signs such as thirst, dry mouth, dark urine, dry stools, constipation. Other classic heat signs are red face, sweating because body fluids are driven upwards and outwards, rapid pulse, and a red tongue. Another form of pathological heat is yin deficiency heat. It is extremely important to differentiate between empty and excess heat. This is because the treatment strategies for each are very different. Yin deficiency heat does not arise due to the presence of excess heat, but the presence of excess heat will certainly accelerate the process. Yin deficiency heat arises when the body or specific organs are yin deficient. Yin, when it is weak, is unable to control heat, which then flares up. There are some fundamental differences in how the two types of heat manifest in the body, and this can be seen in our discussion later. When there is excess heat, the treatment must be aimed at draining the pathogenic heat. This means that the acupuncture points used need to have a heat draining action, and draining needle technique should be used. In herbal medicine, herbs and prescriptions that either drain or expel heat should be used. When there is yin deficiency heat, treatment aim is primarily to nourish yin. This means that acupuncture points that nourish yin are used. These points should be stimulated with a tonifying needle technique. In herbal medicine prescriptions, herbs that are yin nourishing are used together with herbs that clear the empty heat. Apart from differentiating between empty and excess heat, it is also important to identify where in the body the heat is and which organs are affected. This applies to both empty and excess heat. Differences between excess and empty heat. With excess heat, there is constant sensation of heat in the body. The entire face is red. The person either sweats all the time or not at all. The person sweats all over the body and especially on the head. The entire hand feels warm when palpated. In empty heat, the sensation of heat is primarily in the evening and at night. Only the cheekbones are red, the person sweats at night, the person sweats mainly on the palms of the hands and the soles of the feet. Only the palm feels warm when palpated. In excess heat, there is strong thirst with a desire for cold drinks, which are drunk in large gulps. There is bitter taste in the mouth, mental restlessness, agitation, manic behavior. Pulse is full and rapid, tongue is red and has a yellowish coating. In empty heat, the person experiences dry mouth and throat, which is most apparent at night. They will generally sip water. There is no bitter taste in the mouth, mild restlessness or unrest in the evening. The pulse is fine and rapid, tongue is red and lacks coating. Another form of pathological heat that must be mentioned here is toxic fire. Toxic fire is a very intense form of fire. The fire is so intense that it damages not only the fluids in the body, but also tissue. All conditions in which there is inflammation with pus, greenish secretions, or erosion of the skin or mucous membranes are defined as being toxic fire. There will often be some degree of swelling in the area. The area itself will be extremely red in color, and the skin above the area will be hot to the touch. Due to the concentration of extreme yang heat in the area, the pain will often have a different characteristic and will be very intense. Toxic fire can arise from chronic internal conditions and acute invasions in the exterior, such as by staphylococcal infection, mumps, herpes, and so on. Thank you for your attention.